Hello everybody.
Hi.
Hope everything is okay. Hope MCU is treating you fine. We are back with a brand new topic today.
Yep.
Today we're going to be talking about shoulder problems.
Shoulder problems.
Right. So one of the most common shoulder problems that we hear is
Frozen shoulder.
right. Not everybody has it, but most people think they do when they develop shoulder pain.
Yep.
Right.
Especially when they can't lift up, immediately they think that it's frozen shoulder.
Yes, which is wrong. You may have it, you may not. We are going to be talking about the causes of frozen shoulder, what it does, what frozen shoulder actually means,
Yeah.
and during the initial stage, what can be done at home by yourself before seeking help to a physiotherapist. Right? Let's get on to it.
So, let's talk about shoulder pain. Okay, most of the patients that come and see me, the first thing they tell me is, I think I have frozen shoulder. Okay, bear in mind, you don't get frozen shoulder that easy. Okay, if you have shoulder tightness, that doesn't mean you have frozen shoulder. Okay, so how do you get shoulder pain in the first place? It is your daily routine. Okay, lifting heavy things, heavy loads, cooking, ironing, washing, and also laundry. Yeah, so this movement actually causes pain in the shoulder, but we just brush it off because we need our shoulder in our daily life, so we don't really give importance to that until we get the pain on the shoulder. So I'm going to be showing you certain things on the diagram, and you will understand more from where you get the pain from. Okay, let's get into that. Alright, let's have a look at the shoulder diagram. Okay, as you can see, these are the muscles around your shoulder joint, and the common place, you always get injured around this area. As you can see, nerves and arteries are running through this passage. So if you have a shoulder impingement or a sprained shoulder, it is this area. Okay, so I hope you have seen the brief shoulder diagram. So now let's go into frozen shoulder diagram. Alright?
Okay, now let's look at frozen shoulder. What is frozen shoulder? Frozen shoulder is the layman's term. The medical term for it is known as adhesive capsulitis. Right? Frozen shoulder occurs when the capsule around your shoulder becomes inflamed. Right? You have tissues surrounding your shoulder joint. Your shoulder joint is known as a ball and socket joint. So the socket and there's a ball. I'll explain about that more in a while. So when the tissues around your shoulder joint becomes tighter and thicker, over time it causes scar tissue, and that will cause limited movement around your shoulder. So when you do movements, it will limit your movements. That is basically what frozen shoulder is. Now the cause of frozen shoulder is not known. It is classified as idiopathic. That means the original cause of frozen shoulder is not known, but most of the time frozen shoulder occurs secondary to something, usually overuse or after surgery, after a fall, stuff like that. Now let's look at the diagram and see which part becomes inflamed that in a frozen shoulder, and why it's difficult for you to move your shoulder. This is a diagram of our shoulder joint looked at from the front. Now when you say that you have frozen shoulder, this capsule here becomes inflamed. Now when all these ligaments become tight and thick, it will form scar tissues which will eventually limit your movements, and when this becomes inflamed, it causes frozen shoulder. So basically that's what frozen shoulder means. Okay, example, when somebody goes for a shoulder surgery, after the surgery you are not allowed to move your shoulder for a certain period of time. So when you don't work the joint, all these ligaments will become tight and thick. So when you recover from your shoulder surgery, that's how you develop frozen shoulder. So physiotherapy at that point after surgery is very important. Why? Because we help to keep this joint mobilized. We move the joint without activating your muscles, which means you are not moving your ligaments or your tendons or your muscles. We will help you move it in order to keep this joint mobile. So what we are going to do is, now since you know a brief explanation of what frozen shoulder is, we are going to show you what kind of test you can do at home and what you can do to minimize the pain at home before seeking help from a physiotherapist, right? Let's move on to that. Okay, now let's move on to how you can perform your own assessment at home to see if you have frozen shoulder. Okay, classically frozen shoulder has got some symptoms, some classic symptoms, right? So certain things will be difficult for you to do, certain movements, right? When you have any other shoulder conditions, right, when we do tests, certain movements will cause pain, okay, or certain angles will cause pain. But when it comes to frozen shoulders, all your movements will cause pain. Some movements you will have intense pain. So what happens is, when you go this way you have pain, you go this way you have pain, when you do this you have pain, when you do this or this internal or external rotation you have pain. And when you have pain, what do? Your body will automatically compensate. When I say compensate, that means it uses accessory muscles. So you tend to shrug. Yes, you see, you tend to do this. Instead of doing this, you tend to do this. See, these are what you call accessory movements, right? You tend to use your accessory muscles, which in a long period of time will cause tightness in other muscles. So you will have tightness here, around here, up here. All this area will become tight and painful and uncomfortable. Now, as I explained earlier, your shoulder joint, the ligaments become tight, so every movement will cause pain, right? So what you can do at home is, you do a self-assessment. You move your arm on your own, move your arm up, forward. If you do this, that means you have pain, right? When you do this and then do this, and if you have pain when you do this, that means most likely you have frozen shoulder. Now another very common symptom is you won't be able to go this way. You see, you won't be able to put your hand back. So normally you can do this, but with frozen shoulder you'll only come up to here or here. You won't be able to go all the way up. If you compare it with both shoulders, you will see a significant difference. That is a classic sign of frozen shoulder. So what can you do at home on your own? Start with warm therapy. So use a hot pack, put it on the area. When you put hot pack on this area, you increase blood flow, you increase blood circulation, so your pain will reduce a little bit. It will be easier for you to perform your movements, right? After this, we'll show you how you can do certain exercises at home on your own for frozen shoulder to ease the pain. Now when you have frozen shoulder, if you go to a doctor, what they'll do is they'll give you an injection and then they'll send you for physio. Now why they do that is because when they administer the injection, your pain reduces. So when your pain reduces, you'll be able to do certain movements. This will make life for you easier, and for us, we will be able to manipulate your joints better to get better range at the beginning stages itself, which will fast track your recovery. Frozen shoulder, what will happen if you don't do anything about it? It goes off on its own, but it may take up to 6 months to 1 year. With proper physio, frozen shoulder can be cured within the first 2 to 3 months. Right? We have seen so many people who have walked in here with frozen shoulder who's come and seen us because they have shoulder pain, and when we diagnose it with frozen shoulder, when we work on it properly for the first 2 to 3 weeks, they see reduction of pain. 6 weeks to 12 weeks, significant reduction of pain and increase of mobility, joint mobility. After that, the pain slowly goes off and done. But during this period, you must be careful. You must do certain exercises on your own just to maintain the mobility of your joint. Now we'll move on to the next thing, and we'll show you how you can do an exercise called the pendulum exercise. This is for beginners. So after your hot pack, you perform pendulum exercises at home before seeking help from a physiotherapist. Right. Okay, so pendulum exercise means you are going to mobilize your joints on your own. How do you do it? The best position is lying down. Lie down flat on your bed, let your arm hang off the bed, and then slowly move it clockwise and anti-clockwise. See, when you do this, you are not actually activating your muscles and moving it this way, right? You are letting it hang. You're letting it hang, you're moving it forward clockwise and then anti-clockwise. Clockwise and then anti-clockwise. What we do is we normally do clockwise 30 times, anti-clockwise 30 times. This is exercise number 1. Okay. Okay. Okay, ready? 1, 2, 3. Okay, exercise number 2, same position, same, your arm hangs off the bed, and then you do forward and backwards. This is called flexion extension. So forward, backward. Again, you're not forcing your arm to move, you're just letting it hang, letting it move back and forth. Okay, same thing 30 times and take a break another 30 times. Right? Good.
Alright, after your pendular exercises, you can do stretching. So basic stretching, yeah. So you lie down this way, okay, let your joint, okay, your forearm and your shoulder joint should be the edge of the bed, okay, and you're just going to let go your arm to fall. Let the gravity pull your arm. So you will get the stretch over this area. Can you feel a stretch?
Yes.
So you have to feel the stretch at this area. Okay, this is the first angle. The second angle, you're going to go slightly higher a bit. From 90, you're just going to go higher a little, and you're going to do the same thing. Okay, can you feel the stretch?
Yes.
So this angle, you will feel the stretch at this position near to your chest. Okay, you don't need help to do these exercises because you can lie down by your own self and then you just stretch out with your own time. Okay, alright, the third one, you can do it while you're bathing, because when you're bathing, the atmosphere in the bathroom is warm, so your joints will be a bit relaxed, so you can attempt doing these exercises in the bathroom. So what you do is make sure you're a bit further from the wall. So you're going to crawl. Yeah, you're going to crawl until where you can, and you stop and you just give a slight push. So your body, yeah, your body weight is going to push in a little, and then you're going to crawl back down. Okay, make sure you don't do this when you're doing these exercises. Okay, never do that. So the first angle is side, the second angle is this way. The same thing, you crawl up, you wait there, and then you crawl back down. Okay?
Okay, so today's video was basically a basic educational video on what frozen shoulder is, how you can assess it on your own at home, and how you can manage it on your own at home. Now, this is if you have mild pain on your shoulder. Make sure if your pain is unbearable, please refer to a doctor or a physio first before you go on and do all these exercises. Why? Because when you are in a lot of pain, certain movements may be wrong, so you may not only make your situation worse, you may also injure some other ligaments or tendons within your shoulder joint. So make sure that your pain is mild, and for you to reduce the pain, you can do this kind of exercises at home. But if your pain is severe, please consult a doctor, or you can come and consult us. We will be more than happy to help you guys. Right. So when it comes to the exercises,
when you perform these exercises, I just want to give you a bit of a reminder. You will feel a bit of discomfort when you perform these exercises. No pain, no gain. So do it at your own time, your own pace. Don't have to rush. Take few counts. It can take maybe 5 counts, 10 counts. Just do it slowly. And if the pain gets severe, you please consult a doctor or physio first. So we are more than happy to help you guys out.
yes.
So come and see us, and we will give you our best service to help you guys. Yeah.
So again, if your pain is mild, and after doing the exercises, if it becomes severe, then please consult us or consult a doctor. And as much as possible, when you have this kind of symptoms at the early stage, try to rectify it so that you don't have any other secondary issues.
Yes.
This is the most important part, right? And our job here is to educate you, to show you what you can do at home on your own, and also to keep you informed on the common conditions. So we'll be coming up with new videos on common conditions, or conditions that people think they have. They may have some other issues, but people tends to think that they have this because it's a common word. One example is frozen shoulder, another is slip disc, right? And you can also relate this to sciatica. You hear these words, you feel the pain, and you immediately relate it to that. It may not be that, it may be something else. So we will be doing more videos on slip discs and sciatica and all that, to educate you on what it is, and to do self-assessment on yourself at home to see if you really have it or if you're having something else. So don't forget to like, subscribe and share our videos. Share it to as many people as you can, so more people can benefit from this. We don't use much of medical terms so that this can benefit everybody.
Yeah, you guys
right?
can understand better.
Yes.
Yeah?
So this video is for everybody. Don't forget to like, subscribe and share to our pages, our Insta Wellborne Physio, our Facebook Wellborne Physio, and our YouTube page as well, Wellborne Physio. And our numbers, our contact details are in our Facebook and Insta pages. You can always drop us a DM or a WhatsApp, and we will get back to you as soon as possible. And during this MCO period, we are only taking appointments.
Limited clients.
Yes, we are not accepting any walk-in clients. Very, very sorry about that, but your safety is our importance, right? So we are doing all that is required. We are following our proper SOPs to make sure that we take your temperature, we take your history properly, and we write down your names and all that, just to ensure that we are taking proper precautionary steps to ensure your own safety. We also disinfect our centers every hour to make sure that we are not carriers of the disease and we are not spreading the disease anywhere.
Yes.
So like, subscribe and share. like our Facebook, Insta pages, share it around, let everybody benefit, and we'll see you again
The next
time.
video. Bye bye.
We care.
We share.
Bye.